So, tonight I want to talk about inflammation because they call it the silent killer. And there's a lot of reasons for that. So, and it's one of those things we can really work to address through our lifestyle, either causing us to have inflammation or actually reducing inflammation. So that's kind of what I want to talk to you about tonight is really kind of inflammation at all. So, inflammation is really one of the body's most kind of ancient survival mechanisms. Now, without it, you wouldn't be able to heal from injury. You wouldn't be able to fight infections, really survive from harmful stimuli. Now, so for example, when you sprain your ankle, the swelling and warmth that follows really is your immune system rushing white blood cells and really signaling molecules to really protect the damaged area. Similarly, when you catch the flu, inflammation helps activate fever and immune defenses that really fight the virus. This acute inflammation is beneficial and traditionally is short lived. It resolves once the threat is eliminated and really healing then occurs. So that's the good part of inflammation. The inflammation I want to talk about tonight, though, is chronic inflammation. And this is a very different story. Instead of really turning on when needed and then off when no longer required, the immune system remains on, really on a slow, constant burn. It's kind of like leaving a small fire smoldering in your house. It may not destroy everything at once, but over time, it's going to have a significant damage is going to accumulate. And that's really what chronic inflammation does inside our body. Chronic inflammation has really been linked to nearly every modern disease, from heart disease, cancer. Just one second. Uh, it's been related to autoimmune disease, cancers, and neurodegenerative diseases, and that's really what makes it dangerous. Is it's really often silent. That's why they call it the silent killer. And many people don't even know that they are having problems with this until years of damage have occurred. So we want to really be combating this every day. And so there's different types of chronic inflammation. There's kind of the low grade systemic inflammation, and this most commonly in the form of really it's undetectable really without any blood test. There's certain markers we look at, C-reactive protein and interleukin 6 are the most common things we look at for this. Now, the causes of this, poor diet, obesity, sedentary lifestyle, and chronic stress. The risk here is metabolic syndrome, type 2 diabetes, heart disease. And again, this is often silent, but people may feel fatigue, they may suffer from weight gain, brain fog, or just kind of joint stiffness. So again, this is a very significant and concerning thing that we need to address. There's also autoimmune inflammation. And here the immune system really becomes confused and really begins to attack the body's own tissue. So this is examples of this would be like your rheumatoid arthritis, Hashimoto's thyroid disease, psoriasis, multiple sclerosis. And here, again, the mechanism is the immune system produces antibodies against self-tissue. And this creates this cycle of flare-ups and tissue destruction. The impact here is you're going to have pain, you're going to have swelling and loss of function, and really long-term disability if it's really not managed. And then there's allergic or environmental inflammation. This is triggered when the immune system overreacts to external stimulus. So, for example, allergies, your asthma, eczema, chemical sensitivities. And these can all be triggered by like pollen, dust mites, mold, pollution, pesticides, industrial toxins. And again, long-term risk, you're going to see a lot of chronic airway inflammation, such as asthma. You're going to have skin breakdown and really kind of a persistent immune hyperactivity. And then neuroinflammation, this is kind of a newer area that we're learning about. And this is really inflammation in the brain and the nervous system. This increasingly is recognized as a key driver for mental and cognitive health issues. So causes here is poor gut health, infections, toxic exposure, head injury, stress. Conditions like Alzheimer's, Parkinson's, depression, anxiety, and even migraines are associated with this. Your symptoms are going to be brain fog, memory problems, mood swings, headaches. And then there's also chronic infectious inflammation. Now, some infections will linger or reoccur, and this keeps our immune system really chronically activated. Examples of this would be hepatitis B or C, So you have chronic liver inflammation, Lyme disease, your joints and nervous system's inflamed. H. pylori, this is chronic stomach inflammation that can lead to ulcers and cancer. And really the impact is, again, persistent tissue damage, immune exhaustion, and really high risk for complications. Now, causative factors of chronic inflammation, again, first is poor diet. The modern Western diet is one of the strongest drivers of inflammation. So our refined carbs and sugars, that's the highly processed things, that's going to spike our blood sugar and our insulin, and this causes oxidative stress. Also, the seed oils, your soy oils, your corn, sunflower, these all contain high levels of omega-6 fatty acids, and these really fuel the inflammatory process or pathway. Processed meats, they are really associated with inflammation. They contain certain chemicals within them that worsen inflammation. And then lack of fiber, starving the beneficial gut bacteria really leads to this dysbiosis in the gut, which causes inflammation. So, a diet rich in fruit, vegetable, whole grains, healthy fats, and lean proteins is really protective. Another causative factor is obesity, specifically visceral fat. And so, fat tissue isn't just an inert uh, uh, tissue in the body. It's very metabolically active, and it does secrete inflammatory cytokines. Specifically, visceral fat, that's the fat that's around the abdominal organs, is really, really very harmful. And often we refer to some people as skinny fat, meaning they don't appear obese, but they have a lot of visceral fat. And so that visceral fat is very, very detrimental to our health. Okay, because it's going to release certain kind of chemicals that interfere with insulin sensitivity. And really, again, this leads to a vicious cycle of weight gain, inflammation, and metabolic disease. Another causative thing is stress or chronic stress. Okay, stress is going to trigger release of cortisol. Now, in short bursts, it's anti-inflammatory and good for us. But with chronic stress, cortisol regulation becomes disrupted. It leads to immune imbalance and higher inflammation. So associated conditions like hypertension, depression, autoimmune flare-ups, and stress also really increases unhealthy coping behaviors such as overeating, alcohol, poor sleep, and this is all going to worsen inflammation. Another causative factor is lack of physical activity. Exercise reduces inflammation through several mechanisms. First, it produces anti-inflammatory, what's called myokines. This is released from the muscle. It's anti-inflammatory. It does improve our insulin sensitivity, and it supports the lymphatic flow, really leading to detoxification. So sedentary living, really in contrast, it's linked to obesity, poor circulation, and really systemic inflammation. Then there's environmental toxins and pollutants, so air pollution, pesticides, microplastics, heavy metals, really all create oxidative stress in the cell. And over time, this oxidative stress really fuels inflammation and damages the DNA. So examples, air pollution is now recognized as a leading cause of asthma, cardiovascular disease, and premature death. Another factor is gut dysbiosis. That means really an unhealthy microbiome in the gut. This can lead to leaky gut syndrome, where toxins and really undigested food particles leak into the bloodstream. This is going to really trigger a systemic inflammatory response. So again, causes poor diet, antibiotic use, low fiber, and high sugar. So you see conditions like autoimmune disease, irritable bowel, neural inflammation from this. And then sleep deprivation. Sleep is when the body clears these inflammatory proteins and repairs tissue. So poor sleep is going to cause raises in these inflammatory proteins. And chronic insomnia is associated with obesity, diabetes, and cardiovascular disease. And then finally, smoking and alcohol. Smoking really induces what's called free radicals and toxins that directly damage tissue. And then excessive alcohol impairs liver function, damages the gut lining, and really increases systematic inflammation. So what are the health impacts? And this is what's important because, like I said, this is considered the silent killer. So these things are often going on within our body, and we don't have an awareness until there's some catastrophic event. So cardiovascular disease. Inflammation is going to damage kind of the endothelium. That's the lining of the blood cells. This leads to the plaque buildups or the arterial sclerosis. And then inflammation markers like your CRP are really better predictors of heart attack than your cholesterol alone. So looking at these inflammation markers is important to make sure we're addressing it. And then diabetes and metabolic syndrome, chronic inflammation interferes with insulin signaling. This leads to insulin resistance. Often, obesity-related inflammation worsens blood sugar regulation, and over time, this is how we develop type 2 diabetes. Then cancer, inflammatory cytokines, they damage the DNA. This disrupts something called apoptosis or programmed cell death. Typically, your body, we all have cancer cells in our body, but your body does a real good at destroying them and keeping them at bay. But these inflammatory markers allow these cells to really grow, and that's how you have tumor growth. So, you can see this in conditions like ulcerative colitis, really significantly increases cancer risk. And then autoimmune disease, ongoing inflammation destroys tissues and organs. So your examples would be joint erosion and rheumatoid arthritis, myelin sheath destruction and multiple sclerosis. That's what allows the nerves to send an impulse. And then neurodegenerative diseases. So neuroinflammation accelerates cognitive decline. So, Alzheimer's is linked to inflammation. Depression is increasingly recognized as really an inflammatory condition. And then there's digestive disorders, inflammation of the bowel or inflammatory bowel disease, Crohn's disease, ulcerative colitis. They're all rooted in immune dysregulation. And chronic inflammation damages the gut lining. This is going to lead to malabsorption and further immune imbalance. So important to have good gut health. And then accelerated aging, chronic inflammation shortens something called our telomeres. These are kind of like the little protective caps on our DNA. If you think of like that little end of your shoelace, that little plastic thing that keeps your shoelace from unweaving, that's what a telomere is. And if these are damaged, then we have disruption of our DNA. And this process is really accelerated with inflammation. And so you're going to see, accelerated in your physical decline, and really increase in age-related disease. So what can we do? Well, anti-inflammatory nutrition. So that's one of the most important things is the nutrition we eat. So, adopting a diet that's low in inflammation. So, whole, fresh vegetables, fruits, your fatty fish, nuts, seeds, olive oil, green tea, herbs like turmeric, are all things that help fight inflammation. And then limiting some things. So your refined carbs, your sugary drinks, your fried food, seed oils are all important in limiting inflammation. So there's different types of diets, like the Mediterranean diet, the DASH diet, different things that highlight these. The important thing is a well-balanced plate, if you would, of whole food, fresh type things. And so really limiting the highly processed things from your diet is extremely important. And then weight management is very important. Losing even 5 to 10% of your body weight is going to lower these inflammatory cytokines. You want to really focus on sustainability, using a balanced approach, not like a crash diet, but something that's sustainable over your life, not just try to lose a whole bunch of weight at one time, because we know that doesn't work. People that do that will gain the weight back, and often they gain more back than they lose. And so really a lifestyle is what's important here. And then exercise and really being out and moving, So the aim is for 150 minutes of moderately intense exercise per week. This includes resistance training to really help maintain the muscle mass. Things like yoga, Tai Chi, stretching all improve flexibility and reduce the stress that's driving this inflammation. And then stress reduction. I know I've talked about this before, but stress reduction is extremely important. Again, practical tools like meditation and mindfulness. This is shown to really lower these inflammatory cytokines. Breathing exercises, this activates the parasympathetic nervous system. And then just getting out in nature. That's really, really good for stress management. It helps control or reduce our cortisol and really reduce inflammation. And then sleep hygiene, that consistent sleep schedule, that dark, quiet environment, don't have your screens on, your phone, your TV for a few hours before you go to bed, because you have that blue light exposure that's going to interfere with your sleep. And really strive for 7 to 9 hours of good sleep. And that's going to help lower these inflammatory markers. And then things to reduce the environmental exposure, so filtering drinking water, avoiding plastics or the BPAs, using really kind of natural cleaning and body care products are all things we can do to limit the exposure from the environment. And then obviously smoking and alcohol intake, if we can limit those or we remove those from our kind of things we enjoy, then it's going to benefit you. So, smoking cessation leads to a significant drop in inflammation within weeks. And if you can keep alcohol within moderation, which is defined as 1 drink a day for women or 2 for men, you're going to be way better off in really avoiding this inflammation. Then there's some supplements we can do, and there are, so we really push the omega-3 fatty acids. Traditionally, people think of this as a heart healthy nutritional supplement, and it is, but it has benefit beyond that. One of the benefits is to help fight inflammation. It does this because it's going to reduce these inflammatory cytokines. And again, really, if you're eating well, you can get what you need from, fresh fatty fish or high quality fish, or there are supplements that you can use for this. And then your curcumin or your turmeric is an outstanding anti-inflammatory. It helps block some very key pathways in the inflammatory process. Now, the interesting thing about this is lots of people are on turmeric supplements, but our body really struggles to really absorb pure turmeric. So if you're on a turmeric supplement, one of the things you can do is and they market these too, is add black pepper or black pepper extract. That's going to greatly increase your body's ability to absorb it. So turmeric, in addition with black pepper extract, is ideal because then your body can absorb it. Ginger is another a great anti-inflammatory. It also is a digestive aid. Things like green tea. Green tea extract has very much high antioxidants. This is going to really support brain and cardiovascular health. Vitamin D is another one. We often associate vitamin D with sunlight and bone health, which is very important and which is true. But it also has impacts in other things. And one of the things that it helps is to really help fight inflammation and support our immune system. Magnesium is another great supplement. Very common. This is something that we are deficient in the modern American diet. This is going to help reduce stress. It helps us sleep better and really improve our immune function. Then you have your probiotics and prebiotics, and this is really important into restoring your gut microbiome, really helping balance and reduce inflammation within the gut. And then things like your resveratrol, things found in grapes, berries, red wine. This supports heart health and brain health. And quercetin is another really potent antioxidant. So again, this is kind of highlighting some supplements that can be used to help fight inflammation. But again, all these things that I'm saying, if you're eating well and eating strategically, you don't need to be on supplements. You can get these through good natural mechanism in your diet. So I know this is a lot of information, but the big thing I want you to know is we're all susceptible to inflammation. It's something that just in the world we live in is out there, which causes it to be internally. We are exposed to lots of toxins. So really things you can do every day is first paying attention to what you eat. Eat whole, colorful, nutrient-dense foods. Avoid those highly processed. If it's in a box or a bag, it's probably not good for you. And then, get out and move your body daily. Even just light walking counts. So any type of thing you can do just to get your body moving is going to add benefit. And then again, sleep. Focus on getting good, constant, consistent sleep. And then managing stress. It's one of those things that stress is one of those things that you can't avoid. So we have to learn how to manage it. So again, we've talked before about, breath work and things like that, but really working to manage your stress and be proactive in it. And then just paying attention to the toxins in the environment and really trying to avoid them where possible. Like I've talked about before is the plastic water bottles. That's one of those things that both get microplastics plus also toxins directly from the bottle, depending on how they're stored. And then if necessary, supplementation. There's times that we may need to use supplements because we're not able to get our needs through kind of the natural way. But what are the benefits? Okay, well, it's going to reduce your disease risk, and really, it's going to improve your energy and vitality, and you're going to have better mental clarity, and you're really going to be healthier as you age and really enjoy longevity. Because the important thing to understand is when we talk about health or being healthy, that isn't just mean the absence of disease. Healthy means that you're enjoying life, you have energy, you feel uh, 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 mental clarity, and those types of things. So it's just beyond not just having to deal with diseases, but truly thriving in life. I often say transition from surviving to thriving. Now, one final thing is a note about meal tracking, because I get this asked all the time. Is people often will struggle with tracking their meals. So hopefully you start to appreciate not just a matter of knowing how many calories and what your macros are and what you're eating, but paying attention to what you're eating is beyond just those things. So that awareness of how am I fighting inflammation. So really tracking your meals is going to help increase awareness. Many people underestimate or forget what or how much they've eaten. And tracking meals is going to provide this real clear picture of your food choices, your portion size, and frequency. It also helps uncover habits such as mindless snacking and overeating. It's going to give you better portion control because writing down or logging your foods makes you more conscious of your serving size. It's going to help prevent accidental overeating, especially with calorie dense foods. It also helps identify nutrient gaps. So, tracking reveals whether you're consistently missing key nutrients like protein, fiber, vitamins, or healthy fats. And it really can highlight over reliance on processed foods or really bad things that are not helping us that we're eating a lot of and we don't realize. It's going to support weight management. People who track meals tend to lose more weight and keep it off compared to those that don't. It creates accountability and really makes it easier to stick to a nutrition plan. It also helps really improve your relationship with food because you can notice patterns. Am I a stress eater? Is it a sugar craving at night? And then you can really address these emotional or environmental triggers. And tracking is going to help shift from this unconscious eating to a mindful eating. And that's something that we preach all the time is really mindful eating. Really first enjoying what you're eating, it in and enjoying that moment with the food you're eating, but also having that awareness of what you're eating. Tracking is going to help you support specific goals. So athletes tracking their macros, their protein, carbs, and fats to help support their training. Or people that have conditions like diabetes can monitor their carb intake to help stabilize their blood sugar. Maybe those aiming for muscle gain can make sure they're getting adequate protein. So it's important to help our specific goals. It also may help us recognize our food sensitivities. If you're tracking meals alongside with symptoms like fatigue, bloating, skin issues, you're going to see patterns emerge. And this is going to make it easier really to pinpoint foods that may not agree with your body. And at the end, it's really going to encourage healthier choices. Knowing you're going to log your food often makes you think twice before grabbing processed snacks. And it really kind of creates this built in accountability. So track your foods. Now, you know, so overall, chronic inflammation is one of the greatest hidden threats to our health today. And unlike acute inflammation, which heals and protects, chronic inflammation damages and destroys. Yet is also one of the most modifiable risk factors. And by understanding its many forms, recognizing its causes, and really just taking a proactive step through diet, exercise, stress management, sleep, and supplements, you can really significantly reduce inflammation and really protect your health for years to come. So remember, the journey to wellness is not about eliminating every trigger, but about tipping the balance in favor of healing, resilience, and vitality. So really pay attention to what you're doing, pay attention to this because it's something we all are at risk for. We all have underlying inflammation. But the important thing to understand is this is one of the most modifiable things we can address by our lifestyle choices.